Gotcha. Hi, Mr. Bosley.
Hi.
Hi, my name is Matt. I'll be your student physical
Nice to
therapist
meet
today.
you.
Nice to meet
Ryan.
you. Have you ever been to physical therapy before?
I have not.
Well, so today we're basically just gonna, talk about how you're feeling, what's going on, and then we're gonna do some physical tests and measures just to see where everything's lining up. And then hopefully, we'll get you feeling better and get you going with an initial little game plan and get you on your way.
Sure thing.
All right.
Sounds good.
Excellent. The whole thing will probably take about 30 minutes or so.
Sounds great.
Hopefully. So what do you do for a living?
I'm a postal worker.
Yeah. Actually, first, before I get into anything, how old are you?
25.
Excellent. And what is your date of birth?
1975.
Yes, that's exactly what I thought. All right, so you said you're a postal worker. How many days a week do you work?
I work 6 days a week.
Excellent. And then what does your job entail?
Pretty much do a little bit of walking, probably about 4 miles a day, and a whole lot of driving.
Mm-hmm.
Yeah.
Gotcha. And so, is there anything at your job or anywhere that you can do before that you can't do now?
Well, anything I can do before my job. Well, I like to do a lot of CrossFit. That's kind of what I like to do outside of work.
Mm-hmm.
And it's been kind of hard to do that as of late.
Gotcha. Now speaking of outside of work, is there anything else besides CrossFit that you like to do, or?
Pretty much nothing. No, I get out of CrossFit, and I get out of work. I go straight to CrossFit.
Mm-hmm. Any other involvement in the community, or not really?
Not really. No.
Okay. Where do you? What's your living situation like? Do you live in an apartment, house?
I live in an apartment.
Gotcha. So
Yeah.
any stairs though?
Yeah, I have to get up to the second floor. Not that big of a deal. That's usually okay.
All right. Any smoking, drinking?
No.
Now, what are your workouts that CrossFit consist of?
Well, we do a lot of everything. A lot of deadlifting. A lot of shoulder presses. A lot of cleans, snatches, pull-ups, all the good stuff.
Mm-hmm. Excellent. Yeah, no, I lift a little bit myself, but not quite really into Olympic lifting.
Oh yeah.
Yeah.
Cool.
I don't have the skill for it. So what brings you in today?
Well, I got this pretty constant right neck pain over here.
Mm-hmm.
Kind of goes down to my scap, right about over here too.
Yeah.
Lower, upper right scap area.
Mm-hmm. Okay. How would you say? Does it move around at all?
The neck pain is pretty much right there. It just runs along my scapula.
Mm-hmm.
It's pretty nagging all the time, I'd say.
Got it.
Pretty constant.
Got it. Yes, you said nagging, constant. Do you have any other descriptive terms how you describe it, how it feels?
Probably pretty deep. A little dull, maybe.
Okay. And then how does it, on a scale of 0 to 10, 0 being no pain at all, completely pain-free, and then 10 being like you need to go to the emergency room, where is it at right now?
Right now, I'd say it's a 3.
Using that same scale, where is it at its worst?
I guess it'd be about a 6.
All right. Then at its best, where is it at?
At a 1.
All right. Do you have any other pain that you'd like to report?
Well, I got this index finger pain right about here.
Mm-hmm.
Gets kind of numb sometimes. Get a little tingling there too.
Okay. All right. So numbness and tingling in your right index finger.
Yeah.
Okay. And is that what's that intensity? Using that same scale before, what's that? What's that like right now?
Couldn't really tell you. Feels the same pretty much all the time.
Okay. All right. Okay. So feels the same all the time. All right.
Just gets pretty numb.
Gotcha. Is there? So, do you have any pain in your head?
Nope.
All right. How about your shoulders?
Not the front. Nope.
All right. Any pain down your left arm?
Nope.
Chest?
Nope.
Abdomen?
Nope.
Any pain down your legs?
Nope.
Lower legs, feet?
Nope.
Lower back?
Nope.
Middle of your back?
Nope. Nope.
All right. Back of your head?
Well, not the back of my head, no, but lower neck, yeah.
Got it. So if I showed you this body chart right here, does that look like a pretty accurate representation of your pain?
Yep. Looks pretty alright.
Excellent. And then any other than your index finger, right index finger, do you have any numbness or tingling anywhere else?
I don't, no.
Excellent. Now, do you feel like your two different, your finger and your neck are related at all?
Yeah, now that you mentioned that, when my neck pain gets kind of bad, the finger pain starts to come on too with it.
Got it. And then what usually makes your neck worse?
Well, bending my neck forward like this kind of makes it worse. Turning to my right side makes it pretty bad. And for some reason, every time I sneeze, that tends to bring that pain on a lot. In my fingers too, brings on the numbness too, yeah.
Got it. Now, using that same scale from earlier, if you had to rate those three, where would you say they're at?
The bending forward, I'd say about a 4.
Okay.
The looking over to my right, 4. Sneezing is a little more painful, at about a 6.
And then if you're experiencing pain, what do you usually like to do to make it feel better?
Well, if I just sit down and kind of put my neck up straight, that tends to make it feel pretty good.
Got it.
I like to give a little massage too. That tends to, just like that makes it feel a little better.
That's good. And then, so for when you're sitting up straight, how long until your symptoms go away?
About 2 minutes.
Okay. And then for the massage, how long until it goes away?
About 5 minutes.
Okay. And so when you wake up in the morning, how would you say your neck and hand feel?
It's pretty bad, I'd say. I tend to wake up pretty painful.
Okay. And then going throughout your day, how does your neck and hand feel?
Tend to get a little better throughout the day, yeah.
And then at night?
At night, it gets, it's pretty hard to sleep. Takes a while for me to get to sleep, but I generally tend to sleep all right.
Got it. Okay. Next, we're going to go ahead and review this form that you filled out. First of all, I'd like to thank you for filling it out. We're in the waiting area.
Not a problem.
Just want to make sure, overall, you're in good health. I mean, from what I see here, overall, you seem pretty healthy. I don't really see no family history or problems with like blood pressure, hypertension, diabetes, anything like that.
Yeah, I tend to take care of myself.
Yeah, that's good. CrossFitter, as you should.
Yeah.
So I see you did circle, and you briefly mentioned it before. Lifting and sneezing tend to
that tends to make my pain get a little worse.
Yeah.
Especially at my fingers.
Yeah. So it reproduces those symptoms that are farther away.
Yep.
Okay. Well, I'll definitely make note of that, and we'll definitely we'll get some imaging done. If we can't get these things resolved in the next 3 days or so. Would you say you have any sort of barriers to learning?
I wouldn't say so.
Okay.
You're all right.
All right. And have you had any imaging done?
I did. I got some x-rays done about a week ago. Everything seemed to be all right.
Okay. Well, that's good. And then what kind of medication are you taking right now?
Currently, I'm taking some ibuprofen, 800 milligrams and some Reboxin, 25 milligrams, about twice a day.
Got it. And then, what would you say your learning style is?
A little bit of everything. You know, I'm pretty much a visual learner, but I like to get I like to have it demonstrated too, maybe some hands-on work.
Cool.
A little bit of everything.
Yeah. Well, yeah, I'll take that into account. You know, I assume since you're a CrossFitter, you know, you like to be pretty hands-on with learning stuff.
Yeah.
Very physical person. So could you go ahead and give me I don't know, like a little rundown of like when this started or what happened?
Right. So about 2 weeks ago, I was at a CrossFit competition. Had to do a lot of deadlifts. Came out of it all right, but the next day, I had this pain, the scapular pain here on my back that I was telling you about. That was pretty nasty. So I went to go see the doc that day, and he gave me some meds. Took those, turned out all right. As of recent though, I started getting the finger pain, the numbness, tingling, and that started about 3 days ago.
Okay.
Yeah.
And then have you had anything like this happen before?
Nope, never happened before.
Okay.
Pretty new.
And then what would you say you're looking to get out of this experience?
Well, I'd like to be able to turn to the right without having any pain, for one. And I'd like to get back to the gym, start lifting without pain too.
Got it. Well, believe me, we're gonna do everything we can. I love lifting, and I could not imagine what that would be like if I couldn't lift on a consistent basis. I'd probably come close to losing my mind.
Yeah, I sure hope so, man. Nothing's been able to help at this point.
Yeah, we're definitely, we're gonna stick with it and get you all fixed up. Last thing, real quick, before we go to the sort of some of the physical tests, it says on this this outcome measure here that you gave me, the NDI is 19. Is that correct?
Yeah, it asked me a bunch of questions about my neck.
Yes.
I don't really know what to make of it, but yeah, I filled that out.
Of course. That's excellent. I appreciate that. All right, we're gonna go ahead and move on to the physical part of the exam. What would you say your how is your pain right now? Or not? I'm sorry, not how is your pain? How is your shoulder feeling right now?
I'd say it's pretty good. Feeling all right. I'd say about a 4 out of 10. I'd say.
All right, using the same scale from earlier.
Yeah.
All right. So next, what we're gonna go ahead and do is we're just gonna see if we can't do physical tests.
All right.
So I'm gonna go ahead and the first thing I have to do is we're gonna start with the side that's not presenting with any sort of symptoms. So go ahead and bring your left arm out like this for me. I'm sorry, your left arm. And hold. All right. Anyway, no, that's me. Or that, no, that's like clear. All right, go ahead and bring your arm out forward for me. All right. Any pain with that?
Nope.
All right. Sorry, go ahead and bring this up one more time. And any pain with that?
Nope.
All right, go ahead and bring your arm back for me. Any pain with that?
Nope.
I know what to do now. All right, go ahead and bring your arm up for me. Like that. Go ahead and send it all the way up. I'm just going to apply a little bit of pressure to that. Any pain with that?
Nope.
All right. All right. I'm going to go ahead and go around to your this side.
Okay.
Go ahead and bring your arm up for me. Pressure. And any pain with that?
Nope.
Bring your arm out for me. And any pain with that?
Nope.
Go ahead and bring your arm back for me. And with that,
nope.
Go ahead and hold your arm like this for me. And bring this. Any pain with that?
Nope.
Bring your arm out for me as far as you can. Pain with that?
Nope.
Excellent. All right. Next thing I'm gonna go ahead and have you do is just sitting right here. Go ahead and try to just sort of don't not with your neck, but just sort of like bend forward for me.
Okay.
All right. I'm probably a little pressure. And oh, that's right. I'm gonna do it twice.
Okay.
So first time. Any pain with that?
Nope.
All right. And any pain with that?
Nope.
All right. I'm gonna have you bend back for me. All right. And any pain with that?
Nope.
All right. I'm gonna have you grab your arms like this and rotate to the right for me. All right. And any pain with that?
Nope.
Go and rotate to the left for me. And any pain with that?
Nope.
All right, excellent. Next, I'm gonna have you do is stand up for me real quick. I'm gonna go ahead and have you bend down as far as you can. Try to touch your toes for me. I'm just gonna do the same thing, put a little bit of pressure on you. And anything with that?
Nope.
All right, go ahead and bend back for me. And any pain with that?
Nope.
All right, I'm gonna go ahead and have you go to the side. Side. And anything with that? Oh, all right. Go ahead and go the other way for me. Go the other way. And anything with that? Cool. All right. Excellent. We're going to go ahead and do next is I'm just going to go ahead and have you sit down for me. I'm just going to should I have to take your shirt off to observe posture? Okay. Probably. Did you have a t-shirt on? Okay. All right. Just gonna go ahead and take a look. Just see what I'm looking for is symmetry. Just making sure differences. What I'm seeing is patient is sitting erect, head held in neutral, a little bit of loss of cervical lordosis. Is what I'm seeing. And, all right, I'm gonna go ahead and have you stand up for me and walk a little bit. All right, just go to that wall right there and back for me. All right, and go ahead and come back. All right, very good. All right, gait is normal. All right, could you show me a movement that reproduces your symptoms?
Right, so yeah, turn to the right over here, kind of hurts.
Mm-hmm. Got it. All right, so I'm observing maybe some aberrant motions when he turns to his right and he's looking back. Now, that same scale, 0 to 10, how would you rate your pain when you do that?
That came up to about a 4 out of 10.
Got it. All right, so we're gonna go ahead and do next is we're just gonna see how your neck is moving. All right, so I'm gonna go ahead and have you look up at the ceiling for me. All right, go ahead and come back. Any problem with that?
Nope.
All right. Next, I'm gonna go ahead and have you try to look straight down for me. Oh, any problem with that?
That actually does kind of hurt, yeah. Brings on some pain on my fingers right here.
Got it. All right. I'm gonna go ahead and just measure you there. All right. So I'm gonna have you go ahead and look down for me again. All right. Thank you. Okay. All right. I'm gonna go ahead and have you look to your left for me. Any problem with that?
Nope. Maybe a little bit. Felt
Okay.
a little bit of pain there.
Yeah, on that scale, where'd it go?
I'd say about 5 out of 10.
Okay. All right. Can I have you look to your right for you real quick? I know it reproduces.
Yeah.
Any problem with that? All right, good. Yeah, go ahead and come out of that. I don't want to keep you there for too long. I'm just going to go ahead and I'm going to get set up. This is maybe a little unconventional here. All right, I'm going to go ahead and get set up. And I'm going to go ahead and ask you to rotate to your right for me one more time.
Right there.
All right, go ahead and stop right there. I won't keep you much longer. All right. Could you go ahead and have you bend to your left for me like that? Any problem with that?
That seems alright.
All right. Can I get you to bend to your right for me?
That hurts.
Okay, yeah, go ahead and come out of that. I'm just gonna get a measurement. Oh, do I have, this is gonna require me to put my hands on. Do you have consent to put my hands on?
Yeah, it's fine.
Excellent. Alright, so I'm gonna ask you to go ahead and do that one more time for me.
Right down there.
Okay, go ahead and come out of it. Alright, excellent. Alright. Alright, next, I'm gonna go ahead and have you relax and let me go ahead and do all the work.
Okay.
Alright. So, yeah, this next part's gonna require me to put my hands on you. Is that okay?
That's fine.
Okay. Any problem with it?
Feels fine.
Okay. Since looking down was so painful for you, we're gonna go ahead and skip that.
Okay.
We're not gonna do that.
I don't think I can do that.
Yeah.
I don't think I should.
Yeah, that probably doesn't feel right.
Nah.
All right. I'm gonna go ahead and have you relaxed. Just move you. Any problem with that?
That's all right.
Okay. Okay. And then I'm not gonna have you go to the right. Oh, actually, you know what? I will real quick.
Okay.
All right. Just completely relax and let me know what you're feeling out there.
Oh man.
Okay.
Yeah, that hurts.
I'll take you out of it. On a scale from 0 out of 10, where would you say you're at right there?
That came up to about 7.
Okay. Did that reproduce any symptoms further down here, or?
Kind of did. Now that you
Okay.
mention it, yeah.
Okay.
Got some finger numbness going on, back pain too.
Okay. At any other point, through our exam so far, did it reproduce your lower symptoms?
Yeah, the looking down kind of did that.
Mm-hmm.
The turning to the right kind of did.
Okay.
That seems to be happening, and maybe the side bending too.
Got it.
Over here, that's pretty tender.
That reproduced it. Okay.
Yeah.
All right. I'm gonna go ahead and have you. I'm just gonna relax. Just go ahead and relax for me. I'm gonna go ahead and any problem with that?
No.
Excellent. All right. Then I'm not gonna take you in for right side bending, because that obviously reduces your pain, right?
Thank you.
All right. So next, we're gonna go ahead and do what we call neuro screen. So this next part is just gonna require me to lightly touch you. Do I have consent to touch you with neuro screen?
Yeah, that's fine.
Excellent. The sensation is gonna feel something like this, and then I'm just gonna be going from side to side, doing various things.
Okay.
So I'm gonna go ahead and ask you to close your eyes for me.
Okay.
And does this feel like this?
Feels alright.
Does this feel like this?
Yeah, it feels a little lighter on the right side.
Got it. Does this feel like this?
Also a little lighter on the right side.
Does this feel like this?
Also a little lighter.
Does this feel like this?
That one's a lot lighter.
On the right side?
Yeah.
Okay. Does this feel like this?
It's fine.
Okay. Does this feel like this?
That one's fine.
Does this feel like this?
That one's fine.
And then does this feel like this?
That one's fine too. Yes.
Yes. Awesome. All right. So normally, what we would do next is I would have you look down and then resist me. Not a smart idea. We're not going to do that. And the rotation, I would have you do rotation too. But we're not going to do that too. So I'm going to have you do is hold your arms up like this. Actually, no, I'm sorry. I'm going to have you relax, come up like this. Yeah, I'm going to go hold. Okay, very good. I'm going to have you bring your arms up like this. Very good. And hold. Okay, very good. I'm going to have you bring your arms up like this. Okay, and hold. I'm going to have you, I'm going to have you bring your wrist out like that, and hold. Very good. Okay, and hold. Bring your wrist out like that. Very good. And hold. Then I'm gonna have you. Then I'm just going to pull. I'm just gonna do the opposite thing. So keep your arms up like this. Then we go hold, 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 and hold, hold, hold. I'm gonna have you try to bring your hand in like this. Hold, 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 and hold, hold, hold. All right. I'm gonna go ahead and let's see. I'm gonna try to squeeze your fingers together. Or try to keep them out for me. Good, 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 good. And then go ahead and hold your thumb up like this for me. Hold, hold, hold. Good. And hold, hold, hold. Good. All right. Next, I'm just going to be testing some reflexes. So I'm actually going to go ahead and have you hold your arm out like this. This side. And we're good. All right. I'm going to come around the other side. And just go ahead and relax for me and close your eyes if you want. Very good. All right. Next, go ahead and here. Go ahead and relax for me. Good. All right. All right. I'm gonna go ahead and do this one. Yeah. All right. Then I'm gonna do right here. This one. That's very good. All right, next, I'm going to go ahead and just perform some tests on you. I'm going to ask you to, I'm going to provide like a little bit of compression on your head.
Okay.
All right, let me know if you feel anything. Okay. And what'd you feel with that?
Doesn't feel too good.
Okay.
Not too sure though.
Did it reproduce your symptoms though?
A little bit.
Okay. I'm gonna ask you to move your head to the right a little bit.
Okay.
I'm gonna do the same thing. And down.
Oh yeah, that one definitely did it. Yeah.
On the scale of 0 to 10, where are you at there?
Probably a 6.
Got it. All right. Okay. So since that reproduced your pain, I think I've actually got something for you. Could you go and lay down for me real quick?
All right.
And let me know what happens to your symptoms when I do this. How does your symptoms feel?
That actually makes it feel a lot better.
Excellent. Good, good, good. That's what I like to hear. All right. All right. And then the last thing I'm going to have you do is I'm just going to have you completely relax your right arm for me. I'm actually going to have you come to the edge of the table for me. All right. I'm going to go like that. All right. Extension. Down.
Oh man, that feels tight.
Right there.
Yeah.
Can I get you to bend your head to the left? Bend your head to the right.
Oh, it makes it worse.
Yeah. Bend your head to the right. How does it feel?
A lot better.
Okay. Good. Okay. Okay. Next, I'm going to go ahead and have you sit up for me. I want you to go ahead and grip my finger as hard as you can.
You sure about that?
Yeah.
Okay.
Holy cow, alright. See, you know, hang on, grip as hard as you can. Holy cow, alright, you definitely a CrossFitter. Alright. So, the next thing we're going to do is we're just going to test your muscle strength. And it's kind of similar to what we just did in the neural screen right there. So I'm gonna go ahead and have you bring your left shoulder up for me, like this. There you go. And hold, hold, hold. Excellent. Go ahead and bring your right arm. Okay. And hold, hold, hold. Excellent. I'm gonna have you just like before, elbows up like this, and hold, 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 hold. Excellent. And hold, hold, hold. Excellent. And hold, hold, hold. Excellent. Okay. All right, and I'm gonna bring your arms like that one more time, and try to bring this wrist forward. There we go. Hold, hold, hold. Now back. Hold, 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 and bring this wrist forward. And hold, hold, hold. Now bring it back on me. And hold, hold, hold. Okay, very good. All right. The next thing I'm going to do is I'm just going to actually have you face down for me. Right there. Yes, sir. You got it. All right. I'm just going to be feeling around a little bit. All right. Around, you go ahead and you let me know if I am over anything tender.
That feels pretty tender right there.
All right. So what I'm looking for is his right parascapular and medial scapular border is tender to palpate, and I'm finding some soft tissue guarding the cervical spine more on the right side unilaterally than the left side. And then I'm just going to go ahead and assess a little bit of joint play right now. All right. So, C2. Okay. C3. Just walking my way down.
That one feels a little tender.
Okay. So with joint play, I find mobility with Pavins C4 through 7 are pretty normal, with an ache sensation at 6. And then there's no peripherization of symptoms. And then also, similarly, unilaterally, unlike the left. And right unilateral at C6 is worse and aches with an increase of right hand numbness. I'm not good through it. Okay, so if I work my way down, so C2, 3, 4, 5, 6, okay. Get on unilateral, right unilateral, so if I go down, he goes out.
Out.
There you go. Worse with ache. All right, did you have any, how are your symptoms with that?
Pretty painful right now.
Any numbness or tingling in that right hand?
I started feeling it a little bit towards the end there.
Got it.
Right on my hand.
Got it. All right. So that is going to go ahead and conclude our exam.
All right.
You can go ahead and sit back up for me and go ahead and put your shirt on. Now, on that same scale of 0 to 10, where would you say your symptoms are at?
Pretty. I think they went up a bit, maybe to like a 6. Actually, no. I think about it. 3.
I think it was kind of when you sat up there.
Yeah.
Excellent. So, what I'm thinking is that over the weekend when you were deadlifting, you're so basically, you know, you got nerves going down like sort of like the back of your spine here.
Yeah.
And when you were deadlifting, something happened where one of them got a little bit irritated. So I'm thinking that's what's causing this irritation that's going on up here. And then it's funny how it sort of runs down towards your hand.
Okay.
So what we're basically going to be doing is we're going to be trying to reduce that irritation, which means we're going to be just trying to open that space to give that nerve a chance to like heal a little bit.
Okay.
So the first thing I'm going to do for you is, I'm actually going to ask you to take your shirt off again.
Okay.
First thing I'm going to do for you is I'm going to go ahead and have you lay down on your back here. And so right in is the worst. So I'm going to raise the table a little bit here. I'm going to go Alright, when you go knee down to C6, well, I'm not talking to you. I'm going to do some side glide. We're just going to work on opening up that space with what we call side glides right now. Just going to work on opening up that space. And we're going to do 3 bouts of 30 seconds of side glides to open up the space. So that's 1. 30 seconds. Relax. Yeah. Okay, relax. All right. Next, what we're gonna do is we're going to work on a little bit of. So, just go ahead and relax for me. I'm going to take your head and let me know when your symptoms start to come on.
Right about there.
Okay. So I'm gonna back off a little bit. And I'm just going to go right up against where they start to come on, and we're going to work on a little bit of rotation. And with this, we're going to go 3 bouts of 30 seconds. All right. You can go ahead and sit up for me. That was your, how are you feeling with that?
Yeah, it feels a little better right now.
Yeah, if you had to put it on the rating scale, where would you say it's at?
I think it went down to about a 3 or 2.
Awesome, excellent. So I'm gonna go ahead and do, as since that seemed to help you, we're gonna try to continue this momentum that we've got going. And I'm going to send you home with some reinforcing exercises to reinforce that.
All right.
I would go ahead and recommend maybe, since this is feeling bad, staying away from doing CrossFit for a little bit. And then maybe start with these self-help exercises. And then also maybe a little bit of like self-help. So how does that sound? How's that sound?
I don't know how I feel about stuff my lifting, and maybe these like little things you're doing. I don't think they're gonna do anything for me down the road. Okay. It's just like you just barely even move my head. What's this even gonna do?
Okay, I understand. Would you want to try the? If I showed you how to do something, a little mini exercise for your home, would you do that?
I think yeah.
Yeah.
I think that'll probably do me. That'll help me out. Yeah.
Okay. All right.
I'll try that out.
Excellent. Yeah, I tried to just put the control in your hands. Sort of, kind of weren't really being receptive to any suggestion that I have. So I mean, really, it's up to you to feel better and get back to lifting. So I put the control in your hands. I'll give you as many options as you want, but
right.
At the end of the day, you got to pick one, and it seems like you did. And so we'll go with that one. I'll show you.
That sounds good to me.
Yeah, I'll show you how to do it. So what we're gonna go ahead and do is you're gonna put the towel around your neck like this, and then going to, so you're rotating towards, side bend away, rotate towards. So yeah, so with these, the goal just to open up that space on the right side. You usually side bend away and then rotate towards. So what this component is helping you do is the rotation component. So you're just gonna be sort of looking and assist a little bit. You can even go down to the spot in your neck that's tender, and then put the towel right there, and then you can help rotate it. And you're gonna go about 3 sets, 30 seconds, twice a day with that. And you could also even do just bending away from the side of your pain. You can go 3 sets, 30 seconds, twice a day, and do it with this. So yeah, just I'll do that, and then yeah, that basically that concludes our time here. So I'll go ahead and I'll set you up front with our front desk person, Janice.
Alright, yeah. Cool.
She's really
Janice,
nice.
cool.
Got a warm, friendly smile. I'm gonna go ahead and I'm gonna want to see you at least like twice a week, and hopefully we'll get you feeling better here.
Sounds good, man.
All right, good to see you.
Good to meet you.